So I'd like to introduce Ami Villmeter, who has landed in Dublin this morning, and we're looking forward to spending the rest of the afternoon today and tomorrow as well, talking digital, getting to know each other a little bit more, talking big picture for what's going to be coming down the future. So Amy's here in capacity as the UK account manager for Shining 3D, and you've been working with Shining now for 6 months or so.
I have indeed, yes.
Brilliant stuff. And how's that been for you?
It's been amazing. What a learning curve. My background does come from dentistry, but never sort of been in the full digital world. So this has been a lot of learnings. It's exciting in the fact of how sort of innovative the products are and what they're offering out now. So I'm looking forward to the next 6 months.
Yeah, brilliant stuff, and many more years after that, I hope too as well.
Indeed.
So it's been great for us as well, having a point of contact on the ground as well. And I think by Shining putting a headcount on the ground in the UK, it's a big statement of their intention. Of course, covering Ireland as well. We have to say. So I suppose our first interactions with Shining was in 2021 at IDS, like during that first COVID IDS that we had. And I think what really stuck out, Shining were always on the radar for us. It's a brand that we were always aware of, but we were looking for a brand that was, this was innovative. That's not necessarily relatively new, but somebody that was kind of progressing in their digital journey. And I guess in 2021 they launched Aoralscan 3, which is their third generation scanner. We always joke about the first one; they don't talk about it anymore. The second one, it was a good improvement, and with Aoralscan 3, they really nailed it. So maybe you could tell us a little bit about Shining as a company and their digital story.
Yeah, so Shining was founded in 2004, focusing on industrial 3D solutions. And then in 2012, they released focused on the dental world, digital dental world. Based in China, but we're fortunate enough we've got a headquarters in Stuttgart that has an extensive team of application engineers that are there to support. Basically they're sort of, like you say, innovative and sort of forward-thinking, really focused. So,
for sure. And that's obviously one of the key reasons, one of the key features we were looking for when we're looking for a new partner to work with. And I suppose one of the things for us over the past few years was kind of having conversations with people who are Shining 3D. And they were a relatively unheard of brand, but of course then last year, with the launch of Elite, that really put Shining onto the map and made the world, very much a digital dental world, very much aware of who Shining were. So happy birthday, Elite.
Indeed.
We are coming up to, we've just passed the 1 year anniversary, and I have fond memories of the day after it was launched. I was straight over to your part of the world, over to Bristol, to visit with Dr. Ali Varani, and we did our first live Elite scan, and it was quite incredible actually. Then I suppose from my point of view, having been in digital dentistry since 2007, and every new product comes along, and you hold your breath a little bit. Is it going to work? Is it going to deliver? And what we can safely say about Elite is it delivers every time. And on that first experience, the first clinical experience we had a patient come in that day, implants fitted, surgery, scan, printing. The patient walked out the door with 3D printed teeth. So maybe you can tell us a little bit about Elite and what makes it unique.
Yep, so the Elite is the first of its kind. It combines not only intraoral scanner, but actually with photogrammetry now incorporated into it, which allows implant specialists to have accurate measurements for implant placements. And it's just overall become sort of a real hit now.
Yeah, no, certainly. It certainly has. And I think one of the key things is that prior to Elite, photogrammetry, which has become the gold standard for accurate measurement of implant placement, it was an extraoral scanning process. It was an extraoral scanning process, so you needed another scanner, you needed another device, you still needed an intraoral scanner. And I think that's what people often kind of maybe miss out on with Elite is it's a fabulous intraoral scanner and it's got photogrammetry. So it's not exclusive to just to implant situations and scanning situations. So of course, and I'd love to talk kind of from a technical point of view all day long about some of the technicalities, but we won't go into that. But what I do want to point out is the scan body kit, which is used as a fundamental part of the process. So I remember when we started off, we had 3 kits. The first kit being based on the Nobel multi-unit connection. Where are we now in terms of how many systems are out there that we can connect with?
So we've got multiple implant systems now, and it's growing weekly. We have now 8 kits that are available, dependent on which implant system is used in the practice. And basically, it's constant. We've got a huge R&D team that's listening into what's needed and are constantly developing the kits relevant to the implant systems that are not yet available for it. It's like I said, we've got updated sheets on our website that kind of give you an accurate list of them.
And I guess the Kit A is the first one that came out, of course, Nobel compatible, and that covers, I guess, maybe 80%. So it's down to the size of the implant, the diameter of the cone, and the screw thread. So actually, there's a lot of cross compatibility. So Kit A, of course, covers a multitude. So, but it's great to see the commitment and the innovation and the R&D and the ongoing. And I know sometimes it's easy for Shining, and they'll put an implant system. There's a compatibility with another one, so it's easy. But I know, having spoken with yourself and some of the guys in R&D, that the sleeves are rolled up. They're working hard and working with manufacturers to make sure that their kits are working well and ultimately giving us the accurate results that we need. So going back to the point again about Elite and indeed Aoralscan 3 as being an intraoral scanner. So in terms of application and use within various fields of dentistry.
Yeah, so we cover all sorts, well, pretty much everything now. So we've got the orthodontic aspect, the implants, the general cosmetic, even general dentistry. You've got sort of such a broad scope, especially when you combine it with our other products, including the Metismile, which I know we're going to talk about. But there's sort of real scope for utilising it in sort of all fields within the dental world. So.
Yeah. Awesome. Yeah. And Elite has been designed with the implantologist in mind, and of course the photogrammetry aspect is really, really important, and it's really important to bear in mind as well that it can be used for conventional, and what I like to say, traditional digital implant workflows using conventional scan bodies and so on. So in terms of any other dental specialities, is there anything within Elite and indeed Aoralscan 3 that's useful for other dental specialities?
Yeah, it covers all aspects of the dental world. So for example, the orthodontic world, we've got the Ortho Simulator, which can really assist with treatment planning, patient communication, sort of explaining the sort of stage of the treatment. It also is compatible with majority of clear aligner systems, which makes life a lot easier on that as well. We've also got sort of general dentists, cosmetic dentists, general dentists. They're able to utilise it day-to-day scanning. It's a quick, easy scanner. But also alongside this, we've now got our design service, which allows general dentists to be able to submit the scans and be able to receive back their design from a laboratory, ready to be printed or sent to their laboratory to make. So
of course, yeah, and there's some AI in that in terms of crowns. I've seen some of the new features coming through there as well, so it's all very exciting. It's an exciting space, and I guess I suppose the language we often use with our customers is kind of, at what stage of your digital journey are you at? So for those who are wanting to maybe bring some workflows in-house in terms of printing, the bottleneck is often the design step. So it's great that Shining have a service. Excellent. And then another thing, I suppose, actually, is while we're talking about general dentists as well, is what really excites a lot of our customers is the oral health report as well. So that's one to watch. It's kind of, I feel it's kind of maybe a bit in its infancy yet, but I think some of the AI in there and the automatic generation of health reports and the software picking out various things as well. And I suppose another little feature that maybe we've got a great scanner. It's all the software bits and pieces as well, right? There's lots in there, and it's the monitoring aspect as well, which again, it's just another nice one that Shining have in there. I think we should do a little bit more, tell the world a little bit more about it in terms of comparing 2 scans from multiple time points in terms of wear, gingival recession, and any changes that might go on. It's a fabulous diagnostic tool. I've been watching facial scanning for many, many years. It's been something I've been very excited about. I looked at various apps over the years. There's one company and they looked like they were full of promise, and then COVID came in, and then sadly they disappeared off the radar. And then Metismile appeared. So maybe you can tell us a little bit about Metismile.
Yeah, so Metismile is Shining 3D's first facial scanner, released in 2023. It's been an absolute hit already. We've basically got, as you can see, a facial scanner that is not only portable but also can be used on tabletop, which is excellent. So it's got eye-friendly technology in it, so it allows the patient to maintain keeping their eyes open while being scanned, so therefore allowing them to smile the whole way through.
Of course, and that's something that's massively underestimated, because a lot of the technologies, I'm not sure what's there now, I don't believe there's many there, but there was always a bright light. Of course, the patient wants to close their eyes, and you're using the eyes as a marker and as a reference point. So
exactly.
Sure, yeah.
Yeah, so it's been really sort of positive on that. It's fully integrated with obviously our scanners, but also open to utilising it with other scanners as well, intraoral scanners.
Very much in line with the Shining way to do things.
Exactly.
So that, if I remember correctly, you can import your PLY files or OBJ files from any third-party intraoral scanner.
That's it. Yes.
Excellent.
Yes.
Cool. So I suppose, as well as the obvious of capturing a really good 3D scan of the face, the facial feature analysis within the software is really, really cool. So maybe you can tell me a little bit more about that.
Yeah, so it's quite exciting, is that it allows doctors to scan and compare from previous scans all the facial features. Now this is really sort of beneficial in orthodontics, as you can probably imagine, sort of with jaw positioning, but also things like in the aesthetics industry as well, where it sort of looks at the golden ratio and kind of can offer assistance with that as well.
Yeah, fantastic. And of course it's aesthetic treatment and fillers and Botox and all that kind of stuff. And then I suppose if we take it to another level, probably we're looking at, and again, this is what excites me about it, because I don't think it's been used as much, but in terms of maxillofacial applications and cancer treatments and so on, and there's so much there. But the idea to take multiple scans and overlay them and see changes, I think is really, really smart. And golden ratio and landmarks, I think, is really smart as well. There's plenty of interesting stories we've had with that, but we'll save that for another time. So then, of course, we got CBCT integration.
We have indeed, yes, we have indeed, which actually is amazing. I mean, when you actually see it in its full flow, it's something that sort of blows you away. It allows the doctors to have a full virtual patient, and the treatment planning aspects, sort of looking at things, the patient communication, sort of getting them to really see what's happening, their stage of the treatment is huge. So
absolutely, it's incredible. You got your high accuracy intraoral scans brought in with your facial scans, and of course brought in with the CBCT as well. And one of the really nice features I like as well is with the orthodontic simulation. Now, of course, that's it by default, that's in with the Aoralscan software, but it's also incorporated within the Metismile. So if we got an orthodontic simulation, that as well as the teeth moving, the software will then predict any kind of soft tissue and facial movements around that as well.
And that patients love it. I've had some really positive experiences in speaking to patients about this. It's nice to be able to see what's actually going to happen.
And as a whole. In your past experience working in the orthodontic field, I suppose we go into an orthodontic practice and you see the walls covered in photographs of before and after and so on. So it's really nice for the patient to get a feel for what they may look like. Of course, it's not a commitment of an exact expectation, but it sets an expectation, gives patients an idea of how they may look, and gives them something to be excited about as well.
Indeed.
So we're starting to find now that those who do take the plunge and invest in Metismile, that they're starting to scan every patient every time, build up that information. And on one level, it's a I don't want to use the word gimmick by any means, but there's an aspect of, look, 3D information, we're capturing as much data as possible. But the reality is that data can be used in a very true and meaningful way, not only by the clinician, but we're also finding that the labs are starting to love this as well, because particularly on full mouth rehabilitation, they've got 3D scan, they can do a full mock-up, and they're getting to see everything from every angle, see where the lip line sits and so on. Beyond that, and I think you know what I'm thinking, it's as if we've rehearsed this, but it's the jaw tracking. Tell us about that now. It's not just static images anymore.
No, so the jaw tracking is a feature that you can get as part of the Metismile MR, and basically what it does is it allows accurate measurements of the jaw tracking, which can be sent over to the laboratory. Now, as we know, we're using a library of articulators using a particular design software or a manual articulator.
And they're all arbitrary, right? Well, arbitrary-ish. There's some physicality
Of
around it,
course.
but you know, we're just
Yeah.
kind of.
Of course,
Yeah.
we're taking it next level. That's it.
Absolutely.
So this allows the laboratory to have really accurate data sent over to them, and to be able to get really good, accurate measurements, resulting in better end results. You know, better aesthetics, better fit for the patient, and also we've noticed as well a sort of reduction in amount of time for the patient in and out of the practice. You know, that we're getting better results quicker.
Yeah.
So,
less try-ins or less adjustments.
Exactly.
Try-in is fitting first
Exactly.
time, and of course it's and I see that it's whether the patient has teeth, has no teeth, or has implants in place, that we've got the
Exactly.
devices for tracking. It's a very exciting.
It is.
Yeah, it's a very exciting application of the technology, and as I say, everybody who's using it now is starting to love it. So you mentioned Metismile MR. Of course, we've been referring to this as Metismile, which is the original version. So maybe you can just tell us a little bit about the difference between the two. Is there a difference?
Ultimately, no.
Okay.
We've got the actual scanner itself is the same, visually slightly different, tiny difference. But actually, what the difference is these modules that are added on that are allowing you to do the sort of tracking, the jaw motion tracking, the trajectory tracking, and analysis as well. So the Metismile MR is incorporating the 3 modules.
Okay, as part of the purchase, and where those modules, for anybody who bought Metismile previously, they're able to access those modules as well, purchase those modules for sure.
Yes.
Okay, excellent. That's great to get clarity on that. Excellent.